Support comes from Mosby Building Arts, creating bathrooms for daily rejuvenation. More at callmosby.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. On the last day of February 2023, GreaterHealth Pharmacy and Wellness opened in St. Louis's West End neighborhood. In doing so, GreaterHealth became the only Black-owned pharmacy in all of Missouri. It made and added to history 2 years ago. What has it contributed to its community members' health and wellness needs in that time? Joining us in studio to catch us up on that work and his hopes for continued growth, we have Marcus Howard, St. Louis native and founder of GreaterHealth Pharmacy and Wellness. Marcus, welcome back to the show.
Thank you. Thank you for having me again.
So, Marcus, you are a doctor, but not that kind of doctor.
Yep.
Where is it that you got the idea to start a pharmacy from, like in the first place? Where did that come from?
Yeah, I spent some of my time in my professional career in North Carolina. And in North Carolina, there was a guy, his name was Martez Prince, and he had started a pharmacy in Charlotte, North Carolina. And that was when I saw the impact that a pharmacy could make. One, I didn't know that an individual could own a pharmacy, but I also saw the impact that a pharmacy could make in a community. And that was when I first, got the idea that this might be something that my hometown of St. Louis could benefit from.
Mm-hmm. And I stress that point about your not being that kind of doctor, meaning not a medical practitioner or a pharmacist. So how was it that you went about then looking for someone who could be that part of starting a legit pharmacy?
Yeah, it was really just looking for the right person that had a doctorate in pharmacy. So really we were looking for somebody who could bring the personality to a community that would help build trust, because we knew that the first thing we wanted to do was build trust between this healthcare institution and the community. And we knew if we could do that, then we could help people become healthier. And so we went to find somebody, his name was Dr. Kenneth Powell, who had a PharmD degree, who had experience in understanding the relationship between medicine and food, and he had a personality that could bring people in and help build those relationships and help build a culture of health and wellness that we wanted to promote.
Mm-hmm. And as I understand, Kenneth Powell is not a St. Louisan, but from somewhere else. What did his experiences, maybe where he was from or where he grew up, how did they translate to St. Louis?
It's a great question. He's from Memphis, Tennessee. So we talk about a lot of the similarities between Memphis and St. Louis, and so I think he had a really good understanding of the need for a strong understanding of the culture of the people that you support in order to to help them. And so his experiences, he comes from a family of entrepreneurs as well. And so he also understood the entrepreneurial side of starting a business and, had experience as a pharmacist. And so he was really the perfect fit.
So, Marcus, the name of the business that you have is GreaterHealth Pharmacy and Wellness. That's an ampersand there, which means that these things are one.
Exactly.
Right? Why was it not enough to have a pharmacy by itself?
Yeah, I think it goes back to building trust. One of the things that that we understand is that in order to make people healthier, that bridge, that trust gap has to be closed. Because we laugh and joke and talk about just cultural differences. And so people in our community, they took certain products and they took certain medicine when their grandmother gave it to them, when their father gave it to them, when somebody they trusted gave it to them. People in our community don't take the medicine if they don't trust who's giving it to them. And so the wellness part had to be there, because when we talked to the community before we, started this venture, a lot of people talked about how they wanted to just be more, they wanted to do more than just take medication. They wanted to learn about healthy eating habits. They wanted to learn about, how to have a healthier lifestyle. They wanted to know more about how to become healthier. It wasn't just about taking medication. So we knew that was one of the first steps to building that trust with the community, is having wellness in the name, so that people know, hey, this is more than a pharmacy. This is a organization that wants to help me become healthier.
Mm-hmm. And I remember our conversation from August 2023, that we had a conversation about that, about building trust.
Yep.
Why is it missing, though? I mean, why is there trust not there between, very specifically, those who live in the community that is surrounding GreaterHealth, and like other chains that do offer medication specifically?
No, that's a great question, and I think that the answer lies in both a historical context and a current context. And so you have historically, you have times in history, such as the Tuskegee experiment, where communities of color were being experimented with and things like that. And so that's a reality that exists, and that's a reality that has been passed down. And so that's the historical context, right? And then the present context is you have organizations that are just large, right? And so as the CVS's and the Walgreens, and there's no knock to them, but as you get so big, the quality of care just can't be the same. And so when people go into a Walgreens or CVS, they just can't get the quality of service because the volume is so high. Mm-hmm. And they can't give that personalized experience, and they can't focus on that bridging of quality health care. And so what happens is, people start to fall through the cracks. People start to feel like, hey, this company doesn't care about us, or the places that we go don't care about us. And so I think that in a current context is why that exists. And so as the organizations get bigger, and there's not a lot of competition, and there's not a lot of smaller organizations filling the gap, the community becomes distrustful of larger companies, and is seen more as a cash grab than a healthcare organization.
Mm-hmm. And that is something that we can all see. I mean, not just in the West End neighborhood,
yeah, exactly,
but small, like mom and pop pharmacies. They're a thing of the past for the most part. Marcus, you all have been quite successful in the last couple years. Can you share a very specific example of how you and GreaterHealth staff, how you establish and then connect with patients so that they keep coming back?
No, that's a great question. I think initially, it started with our process and our design. We designed our pharmacy services with the outcome in mind to build the trust. So we knew what are some things that help us build trust with our community. And one is knowing each person. So, before a person comes into the pharmacy, before we speak to them, we look at their profile, we start to understand, we write things down, we remember birthdays, we remember family members, we remember incidents that have happened in their lives. We ask how they're doing. It's real basic things that that happen that start to build the trust with the community. And so one of the things that we do is we do training. So before anybody in our pharmacy and our company is hired, they have to go through a series of trainings to make sure that they're able to support anybody who walks through the door. So one of our slogans is we support, we take care of all people. And so our pharmacy is, our employees are trained to support anybody who walks through the door. And so some of those things just are basic human things. Hey, ask how they're doing. Use their name when you're acknowledging and speaking with them. Make sure that you are, taking into account the concerns that they're saying, and you're not just trying to give them medicine, or you're not trying to tell them what they should be doing. You should be listening to them. You should be understanding the context in which they're coming in with you, because when people understand or people feel like you are listening to them, then again, those are the things that start to build trust. Okay, my pharmacist listens to me. Mm-hmm. They're not going to tell me, hey, don't ever drink soda again. they've heard that I love soda and they've heard that I drink soda every day. So my pharmacist sits down and we created a plan to minimize the amount of soda I drink so that I can get there. But, but my pharmacist listens to me, he understands me. And so that's a big thing. And so people know when their healthcare provider is actually listening to them and when they're just talking over them.
Mm-hmm. What are some of the most popular services at GreaterHealth?
Yeah, well, our most popular service that over 90% of our customers use is our free home delivery. Mm-hmm. And so that was a service, again, when you talk about building trust, people in the community know when you go above and beyond to support them. And I think that's another way to build trust. So when over 90% of our customers, they get the medication delivered right to their door from a staff member from our pharmacy. And so when they continue to build relationships with the people who are delivering the medication, we're making sure that the people get it. We're making sure that everything is correct. We make sure that, they have options to get counseling on the medications and things like that. I think that's a really popular service because it's convenience. Because right now we know that if we're going to be a mom and pop pharmacy and we're going to be an independent pharmacy, we want to make sure that we make it as convenient as an Amazon does, or we want to make it as convenient as a Walgreens or CVS. And so we don't want to just rest on our laurels that, we're a minority owned company and you should support us. No, we want to be a company that adjusts to the times and says, hey, we're going to make it just as convenient as an Amazon, and we're going to have the same pharmacy service as a Walgreens. And so we're actually an innovative company that provides more convenient, more trusted, and more affordable care. So we're just really the better option. So that's kind of the approach that we wanted to take.
Right. And this is also happening amid closures of pharmacies recently.
Yeah.
And there's one that just happened, right?
Yep.
At Kings Highway?
Yep, and Natural Bridge and Kings Highway, which is one of the, it was a Walgreens that supported a large number of African-American residents in the city of St. Louis, and a lot of those residents on Medicare, Medicaid coverage. And so it's a big deal because pharmacies in our community are closing, and I don't think people realize, I think when, people hear pharmacies are closing, it doesn't really resonate the impact. Mm-hmm. And so access to pharmacy services, pharmacists are the most accessible healthcare provider in a community. Doctors, you have to schedule appointments, nurses, dentists. Pharmacists are the only providers that understand health conditions and provide medication, and you can just walk in and ask a question. And so I think, after a doctor prescribes, somebody in the community sees a pharmacist every month or every 3 months. And so that is somebody that they see often. So when you take that away, that really impacts somebody who is taking 3 or 4 medications, who is struggling with diabetes high cholesterol and high blood pressure. And so now those people are left to their own devices to manage that care by themselves, or having to travel way longer than they have the capacity to get medication and get support. So it is a huge, huge impact, and I don't think a lot of people really understand the impact that it's going to have for people in that community.
Mm-hmm. Since we last talked, the business has grown.
Yeah.
And I see that it was about 10 times growth.
Yep.
And that you are currently operating at capacity.
Yeah.
If, in making a business case,
yeah.
What is it that you need in order to grow and serve people who need medication, who need the wellness aspect of what GreaterHealth is offering?
Yeah. I think the biggest thing that any business needs to scale is money. And so I think it's really difficult, I think, for us to raise money because people hear in the news and they read about pharmacies closing. And so they really don't think about the actual business case that still exists. While pharmacies are closing, that makes it even more of a business case that pharmacies are still needed. Even though pharmacies are closing, people still need their medication. People still, there is still a business of pharmacy that is still growing for independent pharmacies. And so I think, so that's the biggest thing in order to scale, you need money and you need capital and you need low interest capital to get things going. And so that's, currently we are reaching out to investors and reaching out to different entities to try to raise that money so that we can buy a building that was left vacant from a Walgreens leaving and serve and continue to serve that community. But that does take capital. We're a startup. And we do need investors. We do need partners, whether that's a healthcare organization, whether it's just a team of investors to help us. My North Star is that, and if somebody, whether it's an investment bank or an investment group, can come in and work with us to make sure that everybody in our community that's impacted by a pharmacy desert, where a Walgreens or a CVS is closed, that we can take over those buildings and create pharmacies that serve all of our St. Louis metropolitan area. And so that's kind of my North Star, and that's my dream, that investors will come, sit down, see the need and the business case forward, and work in order to move that progress forward and get health care for people that really need it.
Mm-hmm. We'll catch up again in a year or two and see how much of that has come to fruition.
Absolutely.
Marcus Howard is the founder of GreaterHealth Pharmacy and Wellness. GreaterHealth is currently the only Black-owned pharmacy in Missouri and only the second Black-owned pharmacy on record in the state. Marcus, thank you so much for catching us up, and good luck.
Thank you.
This episode was produced by Jada Jones.
Audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
The Gateway brings you the day's news each weekday from around the St. Louis region and the state capitals in Jefferson City.
Our schools are accredited. We don't need this bill.
And Springfield.
How many more years must pass before lawmakers see time is of the essence?
I'm Abby Larico. Join me each weekday for The Gateway on the STLPR app or wherever you get podcasts.